Hello, everyone, and welcome back to the NeuroCalm Fatigue Summit. I'm Anna Gray, your host, and today I'm incredibly proud and delighted to have with me the amazing Dr. Sarah Myhill, who is very well known to MECFS sufferers in the UK, probably internationally as well. But if some of you haven't heard of her, she's a personal hero of mine. She was a GP in general practice in the UK for 20 years. And then became an independent practitioner and is now a naturopathic physician with a very strong interest in what she calls ecological health. And we can talk about that a bit. But she has stood up courageously for the interests of people suffering with fatigue for decades against a medical establishment that has simply failed to understand and therefore frequently failed sufferers of these complex conditions. She's the most investigated doctor in the history of the General Medical Council, but has never ever had a complaint against her by a patient. I wonder why. Sarah, welcome and thank you for doing this. It's fantastic to have you here.
Thank you, Anna, for inviting me. Fire away, ask anything, and I'll throw my best at it.
That is brilliant. Thank you so much. So one thing I'd love you to talk about a bit more is ecological medicine and its relevance to those of us who have long-term fatigue conditions.
Well, there's nothing clever about ecological medicine. It's simply asking the question, why? Now, the problem with modern medicine is it's been boiled down to nasty symptom-suppressing drug, no attention to the underlying disease. Ecological medicine is also about asking what are the mechanisms by which that person suffers a symptom. So what are the mechanisms by which somebody is fatigued? What's the mechanism by which somebody has a rash or an autoimmune condition or whatever? It's all about asking the question why. Because when you can establish what that mechanism is, that has obvious implications for management. So if the mechanism is poor energy delivery mechanisms, then we have to look at how we can improve energy delivery mechanism in the body. So it's very simple. It's just about looking at the question why.
Okay, and where does that why lead in terms of insights for how we think about human beings, how we think about human bodies and their relationship with the world in which they live?
Okay. Nearly all pathology is driven either by poor energy delivery mechanisms or inflammation or both. And the point here is if I could give my patients infinite energy, then they would be able to achieve much, work all day, work all night, sort out all their problems, and they would be very fit and healthy and probably go out and win an Olympic gold medal at the same time. So much about energy delivery mechanisms. And to explain those, the analogy I like to use is the car analogy. Because our body is basically a simple engine, isn't it? And to get your car to go, you've got to have the right fuel in the tank, and that's all about diet and gut function. You've got to have the mitochondrial engine, and that takes fuel from the bloodstream and converts into energy that the body can use, energy to do physical work, do mental work, do emotional work, for the immune system to work, for basal metabolism, and so on. And then you have to have the control mechanisms right. And for me, that's the thyroid accelerator pedal. And the underactive thyroid is incredibly badly treated. And the adrenal gearbox. So we look at those four things. And the single most important one of those is the fuel in the tank. And I have to say, I spend more time talking about diet and gut function than pretty much all other subjects put together. So it doesn't matter where you are, whether you just want to live to your full potential, whether you've got cancer now, whether you've got dementia, or whether you've got chronic fatigue syndrome, the starting point to treat it is the same. You've got to get the fuel in your tank right. And the fact of the matter is we've evolved over hundreds of millions of years. Whenever I have a difficult question, I always go back to evolutionary biology. Go back to nature, go back to the basics. And humans evolved eating a paleo ketogenic diet. Paleo, i.e. no dairy products and no gluten grains. Ketogenic, low carbohydrate, i.e. we should fuel our body with fat and with fiber. And that has very important knock-on effects for the inflammatory side of things, because many conditions associated with inflammation. Because the most pro-inflammatory thing you can do is eat sugar and refined carbohydrates. And the most anti-inflammatory intervention you can do is to run on ketones. Ketones are markedly anti-inflammatory, and you run on ketones by powering the body with fat and with fiber. So the paleo ketogenic diet is absolutely the starting point. And then having established that, then the next thing you have to look at is gut function. And again, I could talk all day about this, but I will try and keep it brief. The human gut is almost unique in the mammal world because it's a dual fuel gut. The upper gut is a carnivorous gut. It's a sterile, acidic, digesting gut, just like my pet dog. By contrast, the lower gut, by which I mean the large bowel, is a fermenting gut. It's there to ferment fiber, just like my horses. So my horses only live on fiber, and my dog lives on fat and meat. We can do both. We can also deal with some carbohydrates and sugars in the diet. Now, that's fine, so long as there aren't too many. But if you overeat sugars and carbohydrates, and guess what? Most Westerners do, fruit juice, bread, potato, pastas, all those things. If you overwhelm the ability of the gut to deal with that, then the upper gut turns into a fermenting gut. And that's real bad news. Because if your upper gut ferments, it then ferments with microbes that are not familiar to us, bacteria and yeast that the immune system is not familiar with. Those, and then if you're eating carbohydrates on top of that, what do you ferment to? Well, you ferment to alcohol, ethyl alcohol, propyl alcohol, butyl alcohol. Somebody gave me a glass of wine for breakfast, I would not be able to function. But that's what happens if you have got an upper fermenting gut. It's also called the auto-brewery syndrome, so that's very memorable. But not just alcohols, D-lactate, hydrogen sulfide, aminoalkyl compounds, and then on top of that, the toxins from the microbes that are there, the mycotoxins and the bacterial endotoxins, and that overwhelms the liver. So the liver then is poisoned by all those substances, and it has to work very hard to deal with them. And the other problem, and I'm quite sure now, this is a major driver of pathology. I was taught at medical school, yes, gut full of microbes, there they stay. Not true. Some of those microbes get into the bloodstream. If they get into the bloodstream, into the circulation, they get stuck at distal sites. They get stuck in our joints, and drive inflammatory arthritides like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. They get stuck in our muscles and drive conditions like fibromyalgia. They get stuck in our skin and drive psoriasis or chronic urticaria or eczema. They get stuck in our lungs, intrinsic asthma, in our brains to drive psychosis. And therefore, to deal with the upper fermenting gut and get rid of it by not feeding them with sugars and carbohydrates is absolutely the starting point to treat absolutely anything, because you fuel the body correctly and you massively reduce inflammation. So that is the starting point. You've heard enough from me. Where do you want me to go from there? And I could go on all afternoon. I'm sure you'd like to have a question.
I'm assuming that's leaky gut syndrome, is it, you're talking about there? Yeah?
Correct. Because if you've got microbes in the upper gut where they should not be, they stick to the lining of the gut and they cause low-grade inflammation. And if you're inflamed, then you are leaky. And that makes everything worse.
Yeah, and then you've got the gut-brain axis. So I guess that's one of the reasons they're talking about Alzheimer's is diabetes type 3.
Absolutely. I mean, yes, exactly. Alzheimer's disease now, and that's a sugar disorder of the brain. Now, the mechanism of that may well be sugar driven, but it may be microbial infection. In fact, as you know, the largest nerve to come out of the brain is the spinal cord. The second largest nerve is the vagus. Mm-hmm. And it's down the vagus nerve where there's an enormous amount of chit-chat between the gut and the brain, and an obvious passage through which microbes may pass. And a lovely illustration of this, if you have had an appendectomy, if you had your appendix removed, you double your risk of Parkinson's disease. Oh, conversely, in the 1930s, there was an operation called a vagotomy that was often done to treat gut symptoms, which was a terrible operation and a rotten idea, but that halved your risk of Parkinson's disease. So just those two simple studies show that there's an enormous amount of cross-chat between the gut and the brain. And what's in the gut is in the brain, and probably vice versa. In fact, I'm going to diversify for another second. Lovely work by a Japanese researcher called Nishihawa has demonstrated that if you've got a fermenting gut and abnormal mitochondrial function, which goes with that, then you've got a fermenting brain. And in the brain, there's potential for those neurotransmitters to be fermented out into neuroactive substances like LSD and amphetamines. And that may be the basis of psychosis. And guess what? We know from work done by psychiatrists like Carl Pfeiffer, Abram Hoffer, that the ketogenic diet, you can reverse and cure psychosis.
Fascinating. I did not know that. So one of the things I'd love you to kind of tell us about as well, Sarah, is the interface between this and the autonomic nervous system? Because quite a few people on this summit are talking about autonomic nervous function and the brain and nervous system role in chronic fatigue. And it sounds as if there's a bit of an overlay here between what they're saying and what you're saying, but that's not a mechanism I've heard overlaid in quite that way before. So I'd love your thoughts on that.
Okay. Well, the point about the autonomic nervous system is that is the messenger. That tells us that something is wrong. So it's not the autonomic nervous system that's wrong, it's what's making it wrong. Now, I'll just give you an example of this. In patients who've got severe fatigue syndromes, their energy delivery mechanisms are so poor that the heart cannot beat powerfully as a pump. So instead of getting nice strong beats, and so you get a regular heart rate with nice strong beats, normal blood pressure, pulse rate about 70 beats per minute, they haven't got the power, they haven't got the energy to the heart to allow that to happen. So what happens is the heart beats rather weakly. It's a rather flabby beat. So the first thing that happens is the blood pressure starts to fall because it doesn't beat powerfully. Now, of course, it's much more difficult to pump blood when you're vertical than when you're horizontal. So, of course, the severe patients lie flat because it's easy work for the heart. But when they stand up, you have to increase cardiac output by about 20%. Now, if you haven't got the energy delivery mechanisms to the heart for that to happen, then the only way the heart can increase cardiac output is to beat faster. So you get this rather flabby heartbeat, but beating faster, maybe up to 100 or 120 beats per minute. But that too is not sustainable. And eventually the blood pressure drops precipitously and the patient has to lie down very quickly before they fall over. Now, that's called postural orthostatic tachycardia syndrome. Many people say, oh, it's an autonomic nerve disturbance, but it's not. The autonomic nerve system is just the messenger. The fact that the starting point is the heart doesn't beat powerfully. So it gets blamed on the autonomic nervous system, but it's not. The autonomic nervous system is just trying to do its best to compensate for somebody who was horizontal and is now vertical. So I think that illustrates the point that many autonomic nervous system disorders are downstream of something else. For example, many people complain of something called MECFS, mast cell activation syndrome. And basically, that's just allergy. And allergy can be switched on by any number of things. And for example, allergy to foods, allergy to chemicals, allergy to inhalants. It might be allergy to microbes in the fermenting gut. And if you've got abnormal fermentation going on in the gut, then all sorts of odd chemicals are produced, which can upset the autonomic nervous system. And again, sometimes it's blamed on MECFS. And what we should be doing is looking at why has that person got mast cell activation syndrome? What is it that they're allergic to? And is it a fermenting gut problem? Or whatever. So it's always about going back to first principles and working out why. And the autonomic nervous system is a little way down the line. It's one of the messengers rather than having an intrinsic abnormality of its own.
Okay, so this why, from the way I'm hearing it, right, takes us deeper into our creaturely intimacy with the world in which we live. It takes us into call it our porosity, but the way that we intake and outtake from the world. And so my question is, we see a rising epidemic of fatigue. How do you frame that? Do you see that as increasing levels of exposure to suboptimal nutrients, toxic load in water, environmental toxic load? And is that related then to this idea of ecological medicine? Does the ecological look beyond the ecology of the body, beyond the bioterrain, as it were, to the ecoterrain?
Absolutely, and I'm not sure I could word it any better than you have precisely. We are not just an individual trotting around the world. We are part of this whole ecosystem. The world has never been a more poisoned place. We are not recycling properly. We're not recycling human compost back onto the land, and so the soil itself is becoming more and more deficient. So I don't bother to do nutritional tests on a new patient because I know what the results are going to be. If you're eating a Western diet, you will be deficient. I guarantee you'll be deficient in B vitamins, in minerals, in essential fatty acids, in vitamin D, in vitamin C, and so on. So, there's just a basic package of supplements that everybody should be taking just to get to the starting line.
Mm.
But yes, we have never lived in a more toxic world. Toxic not just with chemicals from pesticide sprays, and of course glyphosate is such a nasty toxic chemical. There's never been a more important time to eat organic. But we're poisoned by dental amalgam that goes in our teeth, by cosmetics that people put on their skin, by car exhaust fumes, by air fresheners, by indoor cleaning products, poisoned by so many substances. And then we've got electromagnetic poisoning from 5G radiation. We've got this dreadful COVID vaccine that's poisoning everybody. It's so immunotoxic. It switches the immune system on and puts us into a pro-inflammatory and pro-coagulation state. And I confidently predict this winter we will see some terrible pathologies, because it takes about, up to 5 months for the malign effects of COVID vaccines to really manifest. And funny enough, I was at a conference down in London, the Better Way conference, and there was a lovely cardiologist from Guernsey who spoke. Now, Guernsey is very interesting. It's an island, population of 64,000, and he is the only cardiologist on the island. He said about 50,000 people on the island have received the COVID vaccine. And before COVID vaccine, maybe he'd see 0, 1, or possibly 2 cases of myocarditis a year. Now, 23 cases of myocarditis. The average length of time between vaccination and the pathology is 13 days, average age 56. So these are young people getting myocarditis, within a couple of weeks of receiving their vaccine, and because it's a lovely defined community with people not moving in, moving out, that's a very good selection. So we live in a pro-inflammatory world. We live in a world where we're all poisoned, where we are all deficient, and as you point out, chronic fatigue and ME is just the tip of the iceberg. And when I was in general practice in the 1980s, the commonest presentation there, the commonest complaint was the tired all the time patient, TATT. It was estimated that 40% of consultations were because of fatigue. Now, people don't consult their doctors with that symptom now because they know they're useless at treating it. If you're like, you'll get a blood test, say you're not anemic, the thyroid doesn't look too bad. I'm tired too, off you go, do a bit less work, sleep a bit better. But that is not an answer.
Yeah, especially not in a system that pushes people harder and harder as well. I mean, tired all the time is normalized now. It's almost non-pathological in the way that people look at it. It's just, and there's almost like in some environments, there's a competition to see how tired you can be, because that shows, what a kind of champion alpha workaholic you are, and this is extremely problematic, which brings me to another question, Sarah, which is the role of stress in all of this, the role of emotional and mental stress in this picture.
Okay, well, the way I explain this to my patients is that we all have a certain bucket of energy to spend in a day. Now, 2/3 of that energy, 66%, just goes on basal metabolism, just staying alive, basic brain, heart, gut function, which then leaves us, 1/3 to spend. And we can spend that in various ways. We can spend it with physical energy, we can spend it with emotional energy. But there are 2 common holes in that energy bucket, which just drain energy out of us. One is what I call the immunological hole. And many patients with fatigue syndromes, the immune system is activated because of chronic infection, chronic allergy, or autoimmunity. But the other major hole in the energy bucket is what I call the emotional hole. And for example, childhood stress, childhood bullying, childhood sexual abuse hardwires that person for hypervigilance for life. And they are particularly susceptible to fatigue syndromes because they have this huge emotional hole in their energy bucket. The brain is constantly going round and round and fretting, and the brain uses up a huge amount of energy. So just to illustrate that, although the brain weighs just 2% of body weight, it spends 20% of all the energy that the body generates, a massive amount. And so if that brain is constantly busy, constantly worrying, stressed, anxious, then that just it's like tearing up 10-pound notes. You're just throwing energy away.
Yeah, and this can happen at a really somatic, unconscious level, can't it? I mean, some of the stuff I'm looking at is around very, very early attachment issues. This is before bullying. This is just a lack of attuned attachment, which, even a very good parent can have moments of failed attunement. It's, we're human beings, we're limited, it's normal. But those things set up the whole system, don't they, with a certain pattern of, you know, as you said, vigilance or whatever, certain stresses that then emerge later in life in all sorts of ways. In our interpersonal neurobiology, the ways that we relate to people, which can intensify or can, you know, help actually deal with those things depending on whether we're co-regulated and all the rest of it. So again, the ecology here is also relational, isn't it? It's about the quality of our relationships.
Absolutely right. And some of this anxiety and being highly strung is intrinsic, you know, it's in the genes. And that makes perfect sense because humans did not evolve to live in families. Humans evolved to live in tribes. You know, there's a saying, it takes a village to rear a child. And in a tribe, you want a whole selection of people with different skills. So, you know, I would make a good hunter because I like running around doing things, but I sleep very well at night. And when I'm sleeping in the back of the cave, I want somebody who's hypervigilant and anxious on sentry duty, you know, looking out for the predators that are coming. But, you know, if they don't sleep very well at night, then they're not going to be good hunters. So we need a variety of personalities and strengths and powers to survive as a tribe. And of course, nowadays we don't. We live in singular families, and there's family tensions. And well, you know much more about this than I do. But one of the things I'm trying to do here where I live is turn this place into a tribe. So everybody's got their own space. We all share cooking, gardening, cleaning duties, whatever. And that suits me very well. And I think that's how most people should be living.
Yeah, sounds wonderful. And I believe it's true to say that when we're on our own, if we feel alone, that we are more tense than if there's just someone else there. I mean, in evolutionary terms, at a very unconscious scanning level, the human body as a system just feels less safe, which is, I guess, why people living with dogs, if they're on their own as a human with a dog, they're less stressed because there's that creaturely relational comfort.
And that is very well proven that you know, people who have pets are happier and live longer. Equally, you know, if you have a loving couple and one of the couple dies for whatever reason, their partner, the chances of them dying in the next year is massively increased.
Yeah.
You know, we need other people. We need that love, that stability, that interaction. You know, it's the stuff of life, isn't it?
It is. Now, what advice would you have for fatigue sufferers who are isolated? Because this is a huge issue for a lot of people, particularly if you're isolated, alone, and bedbound, housebound.
Yeah.
I mean, I hear this all the time. I'm in some of the online ME groups. One in particular, a really good one that's very positive and uplifting, that run by Raylan Nagel. I don't know if you know her. She's doing fantastic work online. But the thing that I notice more than almost anything lately is the number of people posting about how lonely they are. How do you advise people to deal with this, Sarah?
It's not easy because the business of socializing is demanding of energy, and they haven't got the energy to do that. So if they are going to meet somebody else, then they are dependent on that other person pouring energy into them, whether it's going to visit them, being jolly, giving them mental energy or whatever. And in any relationships work when each partner puts in an equal amount of energy, and then it works perfectly. So, you know, I would say improve energy delivery mechanisms and give them the energy so that they can be funny and extrovert and jolly. They can, you know, get off their beds and go and sit outside, take the dog for a walk. But one of the best things that my ME patients do is I say, get yourself a cat, or get yourself a little dog that doesn't need much walking, because animals are so much comfort and so much fun. I mean, I wouldn't be here without my little dog, who's my companion and goes everywhere with me. Now my daughters have left home, I needed something to love, so I've got Nancy, and then of course I've got my extended tribe. But you know, there isn't a simple answer to your question, and you know, I very much see the whole of life from an energy perspective. If you've got lots of energy, you can go out and have fun. If you haven't got energy, then you're depressed. In fact, I think depression is a symptom that the brain gives you to stop you spending energy, because as you know, we've got a certain bucket of energy. Just to make it clear, we've got a certain bucket of energy. If you spend more energy than you have available to you, then you will die. You will die from organ failure because it hasn't got the energy to work, the brain, the heart, the liver, whatever. So in order to stop you spending all that energy, the body and the brain give you very nasty symptoms to stop that gap closing. And those symptoms are so nasty. If they weren't nasty, you'd go on spending energy and you'd be dead. So they have to be nasty. And it's severe physical fatigue. It's severe brain problems. So you just don't have the energy to pick up the phone and speak to somebody. I mean, the internet is, for many, is a wonderful saving grace, because you can communicate with the rest of the world fairly, using very little energy, and when it suits you, when the time suits you. So, but the internet is never it's never the same as that human company, that human touch, that human kindness, which is what we all need.
Exactly, which brings us back, doesn't it, to the need for embodied relationality. We are ultimately, embodied creature. I kind of think of part of myself as like a little furry animal. It's very creaturely, and we really need to respect that.
Yes.
And in the West, we failed to do that. We, medicine and my discipline of law, treats people like as if the head is removed from the body. There's just this brain in a box that drives this lump of flesh around, at any cost. And we really, one of the things I think MECFS and other forms of fatigue are teaching us is actually the body is this wonderful distributed community of intelligences. It's got an enormous wisdom of its own. It's, there's neuronal tissue in other parts of the body, in the heart, in the gut, and there's a sort of knowing in the body that once we drop into the body and really contact our somatic sensitivity to ourselves, to our emotions, to the world around us, that something miraculous starts to happen.
Yeah, and one thing I often find myself saying to my patients is, for you to get well, you've got to change your personality. You've got to learn to love yourself as you are. And I remember going through I had a back injury, and I had terrible back pain for a while. And I remember almost hating my back because it was stopping me from, getting on and doing things I wanted to do. And I learned, no, you've just got to embrace it. You've got to be nice to it. You've got to be kind to it. And then it starts to heal and repair. But as you rightly point out, so many people, it's all in there, and the body is just an engine to get them where the brain wants to. But it's you've got to look after the whole thing, and you've got to be nice to yourself. One thing that people forget is the most important thing we need to be well is good quality sleep. Now, in the winter, we need more sleep than in the summer. So we go to work and we function, as we are in the summer, maybe going to bed at 10 o'clock and getting up at 6, and then we think we can do that all year round. No, in the winter you have to go to bed earlier and you have to sleep a little bit later, because that's natural. That's how primitive man and primitive woman survived. In fact, I was reading a lovely book about people during medieval times. They go to bed when it gets dark. So as soon as the light falls, they dive into bed. Of course, in those times they didn't have light to read a book or whatever. So they'd go to bed when it gets dark and keep warm and go into semi-hibernation. And they'd stay in bed right until it became light the next day. And then they'd wake in the middle of the night, and that's when they would do their storytelling. That's when the poems would be told and the songs would be sung. And then, it's everybody in, piling in probably one room in a similar bed, and then they all drop off to sleep again.
Yeah, the old 2 sleeps theory.
Absolutely.
Yeah.
Perfect sense.
Yeah, and I guess again that comes down to the rhythms of the body, the rhythms of the world, being attuned to the seasons, to seasonality, to the shifting of the sun, and all of that stuff.
Absolutely.
Yeah. Now, one question I think a few people might want to ask you is the difference between ME and CFS.
Absolutely. Again, it's all about asking the question why. Now, chronic fatigue syndrome arises when your energy delivery mechanisms are down. And that may be because of diet, poor mitochondrial function, the underactive thyroid, or maybe adrenal dysfunction. ME is the clinical picture that arises when you've got poor energy delivery mechanisms and inflammation. And the ME patients have the inflammation symptoms, maybe fever, glands up, and inflammation is characterized by heat, redness, swelling, pain, and loss of function. And they often have, a chronic infection like Lyme disease or chronic Epstein-Barr virus infection or mycoplasma or whatever, or maybe they're allergic to foods. And of course, when the immune system is activated, it produces symptoms of inflammation. So the clinical pictures are different, but there's overlap because the ME patients, that kicks a hole in their energy bucket. So they also have the clinical picture of poor energy delivery mechanisms.
Right. That's really helpful and really clear, because a lot of us use the MECFS acronym, and I know there's a lot of debate, and there's even fury and some discussions about the relationship between the two. But I think that's really clear, Sarah. Thank you very much for that. What one clear piece of advice would you give to the audience listening about one of the most important things they can do in their own healing journey?
Okay. The difference between normal fatigue and pathological fatigue is the delayed aspect. Now, at the end of the day, I will be tired, I'll have a good night's sleep, and tomorrow morning I'll be as right as rain again. But if you have a day and you pay for it the next day, so if you're working hard all week and then you're sleeping in on the Saturday and you're sleeping in on Sunday, that's the beginning of the end. That means you are chronically overdoing things. And if you're chronically overdoing things, you then don't have the energy for healing and repair. And healing and repair occurs at night during sleep. And if you can't heal and repair, then you're going to degenerate. The brain, the heart, the bones, everything will slowly slip downhill. So the one bit of energy I would say is pace your activities or adjust your activities so that you are not paying for it the next day. You are not suffering delayed fatigue. That's the first thing to do. It's called pacing. And it's very important for my chronic fatigue syndrome patients because many of them are constantly pushing themselves to the limit and they never have enough energy left over for healing and repair. And then having achieved that, look at energy delivery mechanisms in order to make your energy bucket as large as possible. Now, I'm greedy. I love energy. I love spending it. But and it's worth putting in place these interventions to make sure I've got as much of it as I can possibly manage. And the starting point for that is diet. And if the real problem with modern Western diets is the carbohydrates in them, and the carbohydrates are so addictive. And once people realize the addictive nature of carbohydrates, and they're eating them not because they're hungry, but because they want a carb hit, once they recognize that, then they have the intellectual imperative to really do the paleo-ketogenic diet and get established on that. And a paleo-ketogenic diet will reverse diabetes, it will reverse dementia, it will massively help prevent cancer and heart disease. It really is the single most important thing you can do.
That's really helpful, thank you. And are all carbs the same for that? For the purpose of that?
No. Unfortunately, sometimes fiber is defined as a carbohydrate, and it isn't really. It's a completely different food. So the worst carbohydrates are the highly refined ones because they give you a very quick sugar hit. And the interesting thing about addiction is it's not the total amount of substance that you consume that gives the addiction, it's the rate of change. So the reasons why cigarette smokers get so addicted to nicotine is because you inhale, the nicotine is in the lungs, and within seconds it's in the brain. So they get this very rapidly rising levels of nicotine in the blood, and that's what gives them the addictive hit. You can always tell the alcoholics, either because they drink very quickly on an empty stomach in order to get that hit, or they take a sip of their wine or whatever, and then they inhale through that in order to drag the alcohol into their lungs, and then they get that addictive hit. So it's the rate of change that gives the addictive hit. And if you eat a refined carbohydrate like fruit juice or sugar or chocolate or something like that, the blood sugar comes up very quickly, and that's what gives the brain its addictive hit. And so and then that is followed by all the hormonal disruption that follows, the insulin level spiking, adrenaline spiking, and you're then on what I call the blood sugar roller coaster. So the slow release carbs, the resistant starches are better than, but ideally you want to be in a state where you are in ketosis at least once a day. So you're running your body on dual fuel. Yes, some carbohydrates, but also ketones, which you get from fat and from fiber.
So metabolic flexibility there.
Absolutely.
Yeah.
Absolutely. And to know if you've got that good metabolic flexibility, intermittent fasting or even fasting is incredibly helpful.
Yeah.
And because if you're not eating for some hours in the day, that gives a real good chance for the gut to clean itself up. And the problem nowadays is people are constantly snacking. And they're constantly snacking on carbohydrate foods, crisps, biscuits, chocolates, sweet drinks, whatever, and feeding those microbes in the upper fermenting gut, which are then fermenting away and literally poisoning the body.
Yeah. Wow. Sarah, I want to thank you so much for this. It's been absolutely wonderful speaking to you. I think your free gift is access to your amazing website, which has the most phenomenal amount of information that anybody could ever want to access. Is that right?
Okay, the first person to email me who's listening to this, I'll send them a free copy of one of my books.
It might be me. I might do it before it goes out.
No problem. I need your snail mail, and I will post it.
No, I won't cheat.
No, but Anna, but do send me your snail mail. I'd be very happy to give you a copy of the energy equation, which
I'd be
it's
really
this book here. It's a quick romp through energy delivery mechanisms, and this picture on the front shows how, the subtitle is "From the Naked Ape to the Knackered Ape."
That is fantastic.
That's what we have become. We have become a society of knackered apes, and we look like this. We're fat, fatigued, and prematurely aged.
Yeah, that is absolutely amazing. We could get onto the whole thing about models of aging and longevity and youthfulness, but we better not. Sarah, thank you so much. Everybody, I just want to thank Sarah on your behalf. I know you will have got a lot from this, Sarah. Thank you.
Brilliant. My pleasure.